At TPG, we're committed to helping you stay informed on healthcare news, compliance updates, and benefit trend information. We know that employers have a lot of information coming at you when it comes to healthcare, and we want TPG to be your trusted resource when it comes to employee benefits. My name's Sarah Friend, and I'm just one of the team members here at TPG working with employers on all things related to your employee benefit programs. This brief segment highlights current news about the Affordable Care Act and the future of the ACA under President-elect Donald Trump, and it also summarizes key messages from a recent TPG webinar. Last month, TPG hosted a post-election webinar led by Wood and Joel Kopperud from the Council of Insurance Agents and Brokers in Washington, D.C. We are pleased to have over 100 participants join us for that webinar, and we made the slides available to you for download and your use. We also promised as a follow-up to that webinar that we would summarize the key messages in a video just like this. So the key messages from that webinar included a summary of President-elect Trump's stated positions on healthcare, the possible paths to repeal of the Affordable Care Act, what a replacement plan might look like, the potential timeline for change, and what employers should do now. So let's start with President-elect Donald Trump's stated position on healthcare reform. This comes straight from President-elect Donald Trump's website, where he makes a call to action to Congress to fully repeal the Affordable Care Act immediately upon him taking office in January. His policy position goes on to state that he would like Congress to repeal the individual mandate, to modify existing health insurance laws to allow the sale of health insurance across state borders, to allow people and individuals to deduct premiums they spend on health insurance policies purchased outside of employer-sponsored health plans, to expand the tax benefits of health savings accounts, to require full transparency of the cost information from hospitals, provider groups, and physicians to promote consumerism, to issue block grants to state for Medicaid, and finally to include some pharmaceutical reforms that allow individuals to purchase prescriptions overseas. 1 month after the election, Americans continue to be deeply divided along partisan lines when it comes to the future of the Affordable Care Act. A newly released poll from the Kaiser Family Foundation showed that only 26% of Americans support the absolute full repeal of the Affordable Care Act. So under Republican control of both chambers, what will Congress actually do when President-elect Donald Trump takes office in January? The truth is, we don't know yet. There's a lot of speculation in the news about how this is all going to shake out in the first 100 days of Donald Trump's administration. But there are some pretty good, clear ideas about what might happen. So we're going to summarize that here. Republicans will not have the required 60-vote supermajority to avoid an almost guaranteed Democratic filibuster against any full repeal effort. A tactic that may be used to repeal parts of the law and avoid the threat of a filibuster altogether with just a simple majority is called budget reconciliation. Reconciliation allows for expedited consideration of certain tax, spending, and debt limit legislation. This would include any components of repealing the Affordable Care Act that have to do with tax and spending. In the Senate, reconciliation bills aren't subject to filibuster, and the scope of amendments is limited, giving this process real advantages for enacting controversial budget and tax measures like repealing components of the Affordable Care Act. If budget reconciliation is used to repeal parts of the Affordable Care Act, that means provisions like the individual mandate, the employer mandate, Cadillac tax, and Medicaid expansion are most vulnerable to repeal. This also leaves the more popular market reform provisions possibly intact, like coverage to age 26 for dependents, full coverage for preventive care, and the rules that don't allow lifetime limits or coverage limitations on pre-existing health conditions. To get a view of what the most likely plan might look like under the new administration, it's important to understand 3 plans that have already been published. The first is Paul Ryan's plan. The second is Orrin Hatch's plan. And the third are the views of Tom Price, who is the newly appointed leader of Health and Human Services under President-elect Donald Trump. Each of these plans and views are different. However, they all build on the current employer-sponsored health insurance system, and they're all directionally aligned to support consumerism and marketplace competition. TPG will continue to stay very close to this conversation and what's happening in Washington, D.C., and share meaningful and relevant information with all of you as it becomes available. So what's the timeline? Repeal of the mandates actually may come quick. There's a lot of pressure on this administration to make good on the promises that were made on the campaign trail. So I expect that something's going to happen in the first 100 days. Replacement may take a little bit longer, and implementation of the replacement plan and the unwinding of anything that gets repealed could take years. Remember that the Affordable Care Act passed in 2010, with major provisions taking nearly 4 years to go into effect. So what should employers do now? For now, we're encouraging employers to stay informed about what's likely going to happen, but act on what you know now. Ways to stay informed include signing up for the TPG newsletter, attending TPG-hosted webinars, and staying well connected to your TPG team. For now, ACA remains law of the land, but as things change, you can count on us to keep you informed and help you understand how you need to take action under the new laws. If you have any questions about how potential changes to the Affordable Care Act impact your organization, please click here and contact us. We would look forward to continuing to be your resource on all information related to your employee benefits program.